Thank you all for joining us today for our first ever webinar on everything you need to know to apply for one of our J. Patrick Barnes grants for research and evidence-based practice projects. We are so honored that Kelly Faltus Brassil has volunteered as one of our esteemed grantees, as well as a member of our grant review panel, to share her expertise in our grant program and how to be most successful in your application. And joining us as well is Dr. Elizabeth Bridges, who is the chair and has been the chair of our grant review panel for many years. So we're just extremely grateful to Kelly and to Liz for all they bring to our grant program, and excited at the prospect of all of you who are with us, either live or in the recording that we're now making, to learn what will really help you be most successful. Our goal at the Daisy Foundation is to make as many of these grants as we can. So Kelly and Liz are here to help you be successful. All right, Kelly, I'm going to go on mute, and thank you so much for this wonderful presentation.
Bonnie, would you like to do the introduction of the history before we proceed?
Oh, of course, I'd be happy to. Just to give some brief background, the grant program was established in 2007. The Daisy Foundation itself began in 1999, right after our Patrick died. But we felt strongly that we wanted a way to support nurses in their spirit of discovery and in creating greater expertise in treatment of patients and families who are afflicted with cancer or an autoimmune disease. To date, just about 100 grants have been awarded, and over $390,000 have been given. And as I hope you will know, funding is up to $5,000 for each research project or each research study, and up to $2,500 for each evidence-based practice project.
So I'll take it from there. Thank you, Bonnie. What I want to make everyone aware of is that we are going to have a good 15 to 20 minutes at the end of the call simply to take your questions. So if questions arise as you're listening in, please hold them till the end of the presentation, when we'll have ample time to answer questions about the content we present today or specific questions you may have about a potential proposal. We're also going to ask for you to complete a survey about your experience with the webinar so that we can continue to improve and optimize this mechanism as we move forward. And also, please note that because it's being recorded, it will be available to share with your colleagues, friends, neighbors, etc. when we're done today. So really our goal for today is to provide you with an overview of the grant mechanism. For those of you who are familiar with the Daisy Foundation or who may have applied for a grant before, this information won't necessarily be new, but what we do want to take an opportunity to do is really focus in on the specifics that we're looking for as a review panel when you're applying, and some of the common challenges that we see with applications to help to support the most effective applications from each of you. The other thing that we want to emphasize is that the Daisy Foundation grant really is intended for anyone. So regardless of your academic preparation, regardless of the context in which you practice, with few limitations, we really invite all nurses to apply for this to further their practice and the care that they provide to patients. The only caveats around this really are that you be a registered nurse practicing in a clinical practice setting. That's where the research should be focused. And I'll ask just again, if you're just joining us, if you can mute your phones while you're in the background so that we reduce feedback during the presentation. The other thing that we're looking for are applications that are really focused on patients and families who are dealing with autoimmune disease as well as cancer diagnoses. And again, the principal investigator in terms of academic preparation can, but is not required to have an advanced degree. So if you're a clinical nurse and you're thinking, I have a project idea I'd really like to implement and apply for this grant, we are talking to you. You are most welcome, and we encourage your participation. We certainly also encourage, if you don't have training in or experience with research or evidence-based practice implementation, that you seek out a mentor in your community, whether it be at your academic institution that your hospital is affiliated with, or someone preferably within your hospital setting who has experience in this area who can support your successful achievement of the grant goals. So a brief overview of our timeline for this fall. We'll begin accepting applications really effective immediately. The first step to this process is submitting a letter of intent. And the letter of intent, which we'll go over in further detail, is really designed to give a high-level overview of what your project is, what funding mechanism you intend to apply for, and some other details about your mentorship, et cetera, that will help to support your project. The letters of intent are each reviewed by Liz and our team to determine which projects are appropriate to move forward for full submission of an application. On October 3rd, you'll receive notification if your letter of intent has been approved to move forward, at which point you'll have just under a month to complete your full proposal. That being said, don't stop your work once your letter of intent is submitted. Please do continue to work up a full proposal so that you are not rushed closer to the deadline. And please also note that the system has a hard stop on receiving applications. So at 5 p.m. the system will shut down in terms of being able to receive. So we know nurses, we're very good at working to the last minute. Just make sure that last minute is 4:59 p.m. Pacific time. And then December 5th, we'll notify our applicants of funding. The funding is then dispersed once the sufficient evidence of IRB approval or waiver has been demonstrated for the project. So one of the big questions that comes about sometimes for individuals when they're developing their work, or sometimes in the applications we receive themselves, is what is the difference between research and evidence-based practice? And for many of you listening today, this may be rudimentary, but for those who might not have background in this area, we really want to emphasize that the research proposals are focused on generating new knowledge and evidence for practice, answering questions that we don't have answers to in the existing literature. Research can be qualitative, quantitative, or mixed methods in nature. So when you're proposing an idea or concept to us, we don't limit the methodologies that you use. We welcome applications of all kinds. It can certainly be aligned to national research priorities. If you work in the oncology setting, for instance, the Oncology Nursing Society puts forth research priorities, as does the MINR and the American Nurses Association. Professional organizations often will put forth research priorities that can help you to really focus not just on what is needed in your individual institution, but what is really needed for the body of nursing evidence and scholarly practice as a whole. Research, of course, has to be reviewed and approved by an IRB. So if you're in a practice setting that doesn't have an IRB, it may involve working with an academic institution affiliated with your practice to be able to ensure that you have appropriate approvals before proceeding with your research project. When we're talking about evidence-based practice, we're really talking about understanding the current body of literature and how that applies to your practice setting, to your patient population. It really takes existing evidence, whether it's from publications, randomized control trials, or even clinical practice guidelines, and applying it to a particular setting and evaluating the outcomes of that application. It requires a really well-done synthesis of the literature so that you know the current state of the science and how it relates to your population. And it really utilizes measurable outcomes to evaluate the impact on practice. So whereas research is measuring outcomes related to an aim, often with, if you're doing quantitative research, aiming to evaluate statistical significance, correlation, et cetera, evidence-based practice measurement is really focused on the patient, the process, or the quality outcomes that your project intends to impact. Evidence-based practice may require institutional approval. At some institutions, they may have set groups that review EVP proposals. At others, it may require going through your institutional IRB and receiving a waiver. Make sure that you vet and determine what the appropriate process is for your respective institution before applying, as funding is contingent on receipt of IRB approval or waiver. So when you're thinking about, I have an idea, I have a concept, how do I get started? One of the first steps is really building your project team. And we talk about this because there are some components that are specific to the JPB Grant. one of them being that project teams must be nurse-led. So if you have an interprofessional project that you're working on now, but the lead on the project is a physician, you would want to talk about how that could potentially be modified, or there could be a spin-off project that could be led by nurses. That's going to be a really important part of the application that we evaluate. We also look for how clinical nurses are involved in the design and execution of the science. So it's not just that nurses are kind of ancillary, they're going to collect data, but they haven't really had input into the idea for the project or the design of the project. Again, we understand that everyone may not have training in research and evidence-based practice, but clinical nurses can certainly provide input on execution in their practice setting, and that's an important part of the application that we're looking for. The team lead does not need to be doctorally prepared, and I emphasize this because many times clinical nurses may feel, I don't have a PhD or a DNP, it's not my job to worry about research, or I don't have time to worry about research. But if you think about all the times in the course of your day where you might say to yourself, there's got to be a better way to do this, you probably have the seeds of ideas that can result in very wonderful EVP and research projects. So we encourage people, regardless of degree, regardless of your training, to look for opportunities to partner with and be mentored in the research and evidence-based practice project in order to apply for this grant. Build a team with diverse skills. One of the challenges for nurses is that we're often so gracious. So when we talk about publishing or presenting or designing a team, we say, well, all these people in my unit think it's a good idea, so they're all going to be part of the project. What you'll often find if you take a project through to completion is that enthusiasm at the outset is high, desire to be involved or get credit for being involved may be high, but when the pedal comes to the metal, often you'll see people drop off. So you really want to design a team that has the expertise that's needed to execute the science that you're going to propose. This could be interprofessional in nature, often may involve a statistician or perhaps a physical therapist or a chaplain, depending on the focus of the project. Build a team that can commit and not only has the knowledge and expertise, but can work collaboratively to get it done. So now we're going to focus on our research applications. Again, as we said before, this would really be focused on answering clinical questions for which evidence doesn't yet exist. And it could be that there's a particular area of interest you have, but it hasn't been studied in the cancer or autoimmune patient population. We really are looking for really innovative ways to explore questions related to clinical practice in this area. Research applications can comprise of one of two typical approaches. One is descriptive. This could be quantitative or qualitative work that seeks to understand aspects or attributes of a population that can either be measured with validated instruments or through qualitative inquiry. And then also we'll see interventional projects come forward. These are projects where we're looking to utilize a particular type of intervention and evaluate its impact on outcomes. We really encourage you to use what we call validated instrumentation. These are instruments, often surveys or questionnaires that have been tested to ensure that they're applicable to a particular population and that they measure what they say they're going to measure. One good example of this, for instance, is the FACT BMT. This is a quality of life measure. It's been tested in the bone marrow transplant population, and it's well validated, meaning that scientists have really done work to make sure that it measures the concepts that it puts forth and that it's applicable to the patient population in which it's being used. We also really encourage you to utilize previously validated instruments as much as possible because they're reliable. But there may be circumstances in which you desire to use a questionnaire that you've made up at your institution to capture a certain aspect of the project for which there isn't an existing validated measure. If you plan to use a non-validated tool, explain the rationale for why. That will help us to understand that you've done your homework and you're ready to move forward. So one of the things that is often helpful is to actually look at a successful project, and that's what we're going to do now. These exemplars that I'm sharing with you are actually present on the DAISY website, And so you are able to view these at any time and by linking into the DAISY Foundation website. So here what we're looking at was the research proposal that was put forth, and really what they wanted to know was what was the most effective way to measure temperature in patients who are undergoing bone marrow transplantation. This is very important because sensitivity to early onset of fever that could be related to neutropenia, sepsis, or possibly to some type of reaction, transfusion reaction or otherwise, is really critical to providing timely and safe care to this population. Unfortunately, at the time that this particular project was proposed, there weren't studies that demonstrated superiority or even evaluation of which type of temperature measurement tool was most effective. So you can see that the specific aims for this population are really well defined here to determine bias and precision of temporal artery and axillary temperature measurements compared to oral temperature measurements in oncology patients undergoing transplant. They then outline their background as to why this research was necessary. So whether you're doing EVP or research, it's really important to know the literature. Demonstrate to us that you've done a review, you understand the state of the science, you understand in the context of research especially where the gaps are that need to be filled. They then outlined very precise methods of how they would be measuring, and they were using a repeated measures design. They were going to be measuring temperatures over time in patients using different types of temperature measurements in order to determine which was most accurate. And you can see that they also include their statistical analysis plan. Here they'll be using a Bland-Altman analysis. As you go through the other examples here, all related to this proposal, you can see further that we provide you with a brief description of what we're looking for. And for those of you who are following along by screen and can see what I'm highlighting now, you'll see that we have a brief description here of what we're looking for in the application, followed by the example from this particular application. And one of the things you'll note here that the authors included and that we will require is that you can speak to how your proposed work is aligned to the goals of the DAISY Foundation. In addition, here you can see we give you 750 words for background and significance because we really want you to be able to articulate where the gaps in the literature lie and how you plan for this study to fill this gap. And you can see that the authors here really beautifully summed up the challenge by saying, here are some limitations of studies that already have been conducted and how they propose to fill the gaps that existed from the pre-existing literature. In terms of methods, you want to make sure that your aims, your methods, and your measures are all aligned. It needs to tell a cohesive story of how you are going to conduct your research in order to evaluate the aims that you're proposing. Here you can see that they're using repeated measures, that the patients serve as their own control, which makes a lot of sense. So if we're measuring oral temperature, axillary temperature, etc., using the patient as their own control makes a lot of sense here. They talk about how the patient will be enrolled to the study, how many patients that they plan to enroll. Here, this is an important consideration that we really look for in your application. We're looking both to understand that the sample size that you've calculated is based on ability to detect statistically significant difference if you're doing quantitative work, correlation, or whatever other statistical aims you might have associated with your project. So your sample size should really be articulate of how you chose the number of patients you're going to evaluate. That's one consideration. The other consideration is that the number of patients that you propose to enroll is reasonable for your practice setting. So another component that we'd like to see you include is how many of these patients do you generally see in a year? If you're proposing to enroll 200 patients, but you only typically see 150 patients in a year's time, it's unlikely that you're going to be able to achieve the goals of your study. It's really important to articulate how many of these patients you're going to have access to as part of your proposal. You'll also see that they've gone on to talk about the different instrumentation that they're going to use, how they selected that instrumentation. In this case, it's in some sense an interventional study with the temperature measurement being the intervention, if you will. And they also then talk about their data analysis plan and every application will be asked to include a timetable. And you can see here we use a chart-like format to outline how you plan to achieve your goals. This chart is also very important because it will help you when you prepare your interim analysis report to the foundation. It helps us to understand, are you on track? If you've said that you'll be recruiting subjects and doing data entry at months 4 to 6, but you're still training study personnel, it might be a flag that the work is not going to be completed on time. Another really important component is the budget, and we're going to talk more about the specifics of budget, but you can see if you're looking at the webpage that the authors here have provided a really concise budget in a table. It outlines what materials they need to complete the study, how much each is anticipated to cost, and then an overall cost associated with the study. And the budget is really important because it will help you to reconcile, once your study is complete, your anticipated and actual cost, so that you can refund back to the foundation any amount that hasn't been spent, as well as to provide an accounting of how the money was spent that you used. So this is one example of a really strongly articulated research protocol. We're now going to go back into the slide presentation. So that's a brief overview of research proposals. We'll now talk about evidence-based practice proposals. Here, again, we can't emphasize enough, evidence-based practice should be just that. It should be evidence-based. And the way that you demonstrate that your project is evidence-based is by putting forth a really nice articulation of what evidence exists in the literature. This could be through an evidence table, although we don't require that specifically in accordance with your application, but using that as a tool to organize your literature at your respective clinical sites can be very helpful in then putting forth the main key findings from various studies or practice guidelines that can help you to make recommendations for the project you're proposing. The proposal should really demonstrate a complete review of the literature, and that the review of the literature is not part of the work that will be done in the context of the funded work. It should be done at the outset so that the project is really focused on implementation. Evaluation should demonstrate whether or not the evidence-based practice change was successful. So we want to look at what measures are going to help me to know if the evidence-based project achieved my goal. So some examples of this are if the goal of your project is to implement aromatherapy, for instance, a well-evidenced intervention in the literature, and it's to reduce the occurrence of pain among your patient population, then you would want to measure, for instance, the mean pain scores of your patients, let's say in the post-operative setting. Again, with evidence-based practice, like with research, the aim of your project should be aligned to your methods and your manner of collecting data. Outcomes can be both process or quality focused. So for instance, if your goal with aromatherapy is to reduce pain so that you can decrease time to discharge for patients, time to discharge is a process measure that would be appropriate. Some of the outcomes might be quality focused. For instance, your goal is to reduce falls or pressure injury or sepsis. Or they could be patient focused, and that could be to improve patient satisfaction with a process or patient satisfaction with the way that you conduct certain components of your care. We really want to be able to distinguish between EBP, which is the application of evidence to practice, and quality improvement. So quality improvement could be evidence-based, and that would be an appropriate project. But if your goal is simply to change up a process in your institution and evaluate outcomes, and it's not based on existing literature, that would be considered purely QI, and it wouldn't necessarily be appropriate for this grant mechanism. And now we'll take a look at an exemplar from the EBP. So here, again, readily available on the website is an example of a really well-done evidence-based practice project. And here they were looking to evaluate the use of exercise, which is well articulated as an intervention for ambulatory oncology patients, to reduce fatigue as a side effect of cancer treatment. There is a great deal of literature that suggests that exercise is a wonderful way to reduce fatigue in cancer patients. And here they were using a program called Energy in Motion that they wanted to pilot with a group of patients in an ambulatory setting who had GI cancer. So they talk here in their background section. Again, you can see there's a lot of referencing in this background that demonstrates that they really reviewed the literature. They have a good grasp on what evidence exists and what recommendations are made for clinical practice. And they talk about then how this practice is going to be utilized in their clinical setting. So again, here, if you're viewing the screen with me, you would be able to see a well-articulated background of about 400 words, followed by a proposed practice change. So here, this particular group of authors talked about, identified the model of evidence-based practice that they would use. In this case, they're utilizing the Iowa model, which is one of several models that exist. Johns Hopkins has a model. There's a model that's put forth by Byrne Melnick out of Ohio State University. So there are several different models of EBP. You can choose any one that best fits the needs of your institution or your project. There may be a particular model that the School of Nursing that you attended educated on. So feel free to use whichever model is most appropriate. Just be sure you can articulate that for your application. Your proposed change then should really outline how you're going to apply the existing evidence and evaluate the outcomes. In this case, they were going to be using a pre- and post-assessment questionnaire about fatigue and quality of life during cancer treatment. And they talked about implementing this at baseline and then again 3 months after they implemented the exercise intervention to be able to assess how patients responded to the exercise intervention. They also really clearly articulated the different types of tools that they would be using associated with the exercise intervention. So for instance, they were going to be using a tote bag with resistance bands, a pedometer, and a weekly exercise contract. And those are some of the elements that you'll again see that come up in their budget that they propose. You also have 400 words to talk about your outcomes, and that you'll be able to put forth how this project influenced your aims. So this is very important here to be able to, again, pull the thread through from your aims, through your proposed project work, and to the outcomes. And you'll also see here that they've done a really nice job of outlining how clinicians will be involved in the project. So how will clinical nurses and nurses in other roles be involved? In this case, they involved what they refer to as a staff nurse opinion leader, or what one might refer to as an informal leader. They also had an APN, and then they had nursing champions who would help to implement the program. And they had a nurse scientist who was mentoring them. There's a second example also here on reducing fall risk among patients. For the purpose of our time, I'm not going to review both of these today, but I will refer you to the end of the second example that demonstrates, again here for the evidence-based practice, the timeline and the budget that was proposed. So now that we've gone over the two types of mechanisms for applying, I want to talk to you a little bit about the application logistics. So let's start with, what is a letter of intent? What does that mean? The letter of intent for the DAISY Foundation is an electronically submitted document. You can go in, you can work on it, you can save it and come back and submit it. I always recommend that if you're drafting a letter of intent that you do so outside of the system using a Word document. It will allow you to spell check, it will allow you to share the letter of intent with other colleagues you might be collaborating with, and make any revisions that are needed so that you can simply cut and paste into the website at the time of submission. The letter of intent is shorter than the full proposal. It provides about 250-word summaries of the major areas that will become part of your proposal, and that includes your background, your aims, your methods, and the clinical nurse involvement. This is a really important time, even though the word count is short, to really give us a high-impact overview of what your project is going to consist of and how nurses are going to be involved in the process. The letter of intent signifies to us that you're interested in putting forth a full proposal. It also allows you to identify your team members and a mentor if you've identified one, and highlight clinical nurse involvement. Don't wait till the last minute to get started on your letter of intent. Review of the literature can take several months to really organize, so we encourage you to start that now so that you're ready to put forth a really strong LOI and move forward to full proposal. The application materials then for the full application consists of any of the following, and some of these are applicable only to the research, so you'll see that they have an asterisk next to them. We're going to be looking for a summary of the science. What do we already know about the current context of your project, and what information suggests the need for further work, whether it's research or application of the evidence to practice. A well-articulated budget, which we're going to talk about in a subsequent slide, and a project timeline that really holds you to the period of 1 year from start to completion of the project. And a year goes by really fast, so be very mindful again about the number of patients you're going to be engaging, and that you can stick to the projected timeline. We also provide a letter of agreement that we ask to have signed by a representative from your institution, for instance, a chief nurse officer, who can attest to the ability and the commitment of the institution to allow your team to complete this work. This is really important because nurses' time is one of the major rate-limiting steps of any research or evidence-based practice project completion. So we ask that your institution make the commitment to support your needs, whether it's in terms of time or additional resources, to get the work done. If you're conducting research, you will need to provide consent forms for patients unless the study involves waiver of consent. That may be obtained after the grant approval has been given, but will need to be provided to the DAISY Foundation before the funding would be distributed. We'll also ask for the primary applicant CV as well as the mentor CV or resume. What we're looking for here is evidence of experience either in the content area or in research or evidence-based practice methods. Remember, the primary applicant can be a novice researcher or a novice evidence-based practice participant, but in that case, they should have a mentor with experience in these areas. We'll also ask for a reference list, which we'll look to. Are your references up to date? Is your review of the literature up to date? And is it evident that you have a good grasp on the current state of the science? An IRB approval letter, if required by your institution, most definitely for research, possibly as a waiver for EBP, would be asked for again before the funds are dispersed, though it may not be available at the time you submit the application, and that's okay. We'll also ask you to include as appendices, as attachments, any instrumentation that you plan to use, whether it's questionnaires or other description of instruments, interview guides, etc. So building your budget, this is a really important question. We get a lot of questions about what can I spend this money on? And for anyone who's had a lot of experience with research, you know that $5,000 and $2,500 is great as seed money, but it also is not going to support a tremendous amount of salary support, et cetera, for your team. So really, the DAISY Foundation is focused on sponsoring the resources that you need to get the job done, which are so important. So here we'll give you some examples of appropriate things to fund for. Often the grant really funds for supplies. If you look at the sample exemplars that we took a look at today, you'll see that most of the budgets include the supplies that are needed to get the job done, and that's a great application of this funding. The exception to this is that we do not buy computers or tablets, iPads, etc. So those are things that would need to be provided for by your institution. We can buy out nurses' time to conduct the project, although we don't provide salary support for research nurses or for a non-clinical nurse PI. So again, we're not able to supplement salary, but what we could do is apply this funding so that you can purchase out a certain amount of clinical nurse time for participation. Also appropriate to use this funding for is data entry, statistical analysis, and or a certain amount of funding for a mentor if they're outside of your institution, as well as potential incentives for participants, specifically gift cards, consistent with IRB requirements. Items that we will not fund include institutional overhead. So if you're like our institution, every research grant has a certain percent of funding that's allocated toward the overall institutional resources that are needed to conduct the science. The Daisy Foundation grant does not support institutional overhead. We've already talked about computers or tablets, and it doesn't support salary for any purpose other than clinical nurse participation. It also is not going to purchase software. For instance, if your institution uses SPSS and has an institutional license for this data analysis software, we will not purchase a single user access for it, nor are we going to supply funding to purchase software that really is at the level of the institution. So if your institution is looking at this as an opportunity to buy that qualitative analysis in vivo software they've always wanted, it's really not the right spot for that in this particular proposal. An exhaustive list of resources can be found at the Daisy Foundation website, and it's linked here in the slide for you so that you can see a fuller list of things that would and would not be allowed as part of the budget. And of course, if you ever have any questions, feel free to reach out. There'll be some contact information on the slide should you have any questions. So now, what is the review panel looking for? We've kind of gone over all of the key components of an application, but when the pedal comes to the metal, what sets apart a successful proposal from one that might be sent back for revision or unfortunately not funded? There are several qualities to a successful application. One is that we're really looking for a team that has the knowledge and experience to implement the proposed work. We want to see evidence that you have a team assembled that's highly likely to be successful with the project. We're looking for, obviously, applications that fit our guidelines, and that means that it must be applied to a cancer or an autoimmune disease population. What we will not fund are studies that are done generically across a larger population and happen to include hematology or autoimmune patients. We're really focused on studies that are specifically and exclusively designed around autoimmune and cancer populations. We're also looking for a demonstrated understanding of an application of the literature to the proposed work. We need to see that you understand the literature and that you've used it to inform either the need for your research or the work that you'll be doing as evidence-based practice. Also so important, and this can be a major hang-up for some of our applicants, providing a realistic timeline and sufficient patient volume to recruit. And I mentioned this earlier to you, whether it's EVP or research, we want to see evidence that you have enough patients to have access to that you can successfully complete the work in the timeline proposed. A well-written application is always best, and a thoughtful presentation that demonstrates the relationships between the aims, the methods, and the measures is so important. Tell us the story and make sure that it's coherent and that each piece is linked to the other. We also want you to demonstrate that clinical nurses are integral to the process, that they're not an afterthought, that they're not going to be used as labor just to collect data on the protocol, but that they're actually involved in the ideas that really support the proposal. For research grants, we really want to look at the applicant's CV and highlight any funded and unfunded studies or EVP projects. So we'll really want to see, does the either individual or their mentor have experience with funded or unfunded work? And the same for the EVP grant applicants. So outcomes and expectations. You might think, okay, I'm ready to do this, I'm ready to go forward. Here's some of what you can expect from us if your funding is awarded. Projects should be completed within 1 year of starting the work. This is true of both the EVP and the research proposals. We're also going to ask for interim and final reports in which you'll provide updates, and we provide a template for that on the DAISY website so that we know how you're doing and how you're progressing with your project. Also, the expectation is that the results of your project are submitted to the Virginia Henderson International Nursing Library, and if you're developing a manuscript for publication, this is a perfect thing to submit and include there. When you're disseminating the outcomes of your studies or your EVP projects, whether through professional presentation at conferences or through publication, we ask that you acknowledge funding from the DAISY Foundation, which any conference or journal would ask you to do. Additional funding is also available to support dissemination of your work via the Lindahl Grant. So we encourage you, if your project is funded, that you apply for this grant for further support to attend conferences to disseminate your work. And now just some high-level frequently asked questions that we'll go over. Do you fund research about nurses? No, we actually fund research that's exclusively focused on patients, again, either cancer patients or autoimmune patients. We've talked about how we can use the funding for salary support, which is exclusively to support clinical nurses' time. Can you supplement the DAISY Foundation funding with other funding to complete the work? Absolutely. Just make sure you articulate to us what specifically the DAISY Foundation funding is going to be used for, and that it's impactful on the overall work that you're proposing. What happens if you don't spend all the money in your budget? If that happens, we simply ask that you provide, as part of your final report, an accounting of the expenses and that you return any money that's unspent. And another question that comes up is, can you include funding for travel to present your work? Not on the research or EVP grant, but yes, on the Lindahl Grant. Other questions that come up relate to eligibility. Do you have to have a doctoral degree to apply? No, but we certainly encourage you, if you don't have experience in either research or EVP, to have a mentor who does. And that will answer question 2 as well. Do you need to work in a hospital to apply? No, we encourage applications from the community settings, from ambulatory care, from private practice. The only caveat is that you must be practicing in a clinical setting. We really encourage individuals who are practicing outside of hospitals or academic medical centers to apply. Other questions that come up have to do with the process. So what happens if I can't complete my project within a year? And we ask that you really consider the timeline that you put forth for your project. We want to ensure that your evaluation outcomes and the number of individuals you plan to evaluate is reasonable. If for any reason you are encountering challenges once the grant is awarded that would suggest that you might not be able to meet the timelines put forth, we ask that you contact the DAISY Foundation early and often to ensure that we're keeping up and coming up with a plan to keep your work on track. You don't need IRB approval when you submit your application. However, you will need to demonstrate it, especially for research and possibly also for EVP, depending on your institutional practice, when you, before your funding is dispersed. Can the DAISY Foundation provide a mentor for me if I don't have one on site? We don't provide formal mentorship for the research and EVP process, but we can try to help you answer any questions that you might have, as well as potentially help you to identify a mentor in your community. So hopefully after this presentation, you're feeling really encouraged about applying. Now what? So we ask that you check out the DAISY Foundation website. The link is here. It will show you all the information you need to know about the application process, the forms, etc. Start your letter of intent now. This is a great opportunity to get started and to really begin the work and ask questions of us as you go through it. We're here to help and support you in that process. Refer to well-established resources on evidence-based practice and research for guidance in developing your project. There are many excellent references out there. We're not going to recommend any in particular, of course, so as not to be biased, but certainly if you're having trouble finding resources that can help you, guide you in this process, please contact us and we're happy to discuss that further. Bonnie Barnes, the president and co-founder of the DAISY Foundation, is the primary contact for questions about the grant. Her contact information is listed in this slide as well as on the website. And now we want to stop so we can allow 15 minutes for questions and answers from you, the audience. So we welcome any questions you have about anything that we've talked about, anything we might have missed, or if you have a particular question about a project you're planning to submit.
Can you hear me?
Yes.
Oh, great. This is Christina Baker. I'm calling from Children's Hospital, Colorado. And I recently changed positions, so I was working as a school health consultant for the hospital. but now I'm in clinical nurse informaticist. So does that, I'm still under nursing, but I'm not doing direct patient care. Does that still count as I'm in a clinical setting, but does that still count as being a clinical nurse for this project or for this research?
Yes, if you are a registered nurse with a valid license working in a clinical setting, and it sounds like you are, you would be eligible to apply. Of course, we encourage you to assemble a team of clinical nurses to help support the design and implementation of your project. Great.
Yeah, I have school nurses, so.
I love that. It would be really exciting to get nurses from that community. They're so important in prevention and continuing care for patients. So thank you for your inquiry and your participation today.
Great, thank you.
Hi, I have a question.
Yes.
Hi, this is Jennifer. I'm calling from Emory Healthcare. Is it allowable to make an amendment or do a sub-study on an already existing IRB if it's the same patient population?
I believe that would be permissible. Liz, I'm going to defer to you. Do you have any other feedback on that?
Yeah, I think that would be fine. I mean, if you had a small study that you wanted to do, it would just require then the documentation from the IRB of the approval of the amendment. So it might be just a little small study you wanted to do. The caveat again is that we really want the people who are leading that initiative to be the clinical nurses.
Okay, great. Thank you.
Hi, can you hear me?
Yes, we can.
Okay, I'm Siddiqa. I'm a professor at California State University, Fullerton, but I also work as a research nurse with one of the local hospitals. And if I will apply for this grant, then it'll be one of my nurses, because I'm not a clinical nurse, one of my nurses will be the PI, and I will be just the support person. My question is, I heard that you said that you are particularly interested in proposals about patients with cancer and patients with autoimmune diseases. So any other conditions you're not interested in? Is that correct?
Yes, that's correct. And I don't know, Bonnie or Liz, if you want to elucidate the rationale for that.
Yeah, this is Liz, and Bonnie I think can jump in. The focus of the Daisy Foundation and the J. Patrick Barnes are on those very unique patient populations, either patients and or their families who have an oncology or an autoimmune disorder. So we are not funding anything outside of that.
Okay. Yeah.
And the reason for that is, as you know, this grant is named for our son, Patrick Barnes, and he actually had both cancer and an autoimmune disease. So that's why the focus is there.
Yeah, I understand. My research is focused on cancer patients, my personal research, but I was just thinking of my nurses. I do work with oncology nurses, so I could possibly submit one of their proposals. But I was just wondering. Thank you for your answer.
Can I just clarify too, as an academic professor as well, you would most likely, so if you have a formal role within the hospital as a nurse scientist, then you certainly could be the principal investigator if you were employed by that hospital. But we would expect to see that on your team would be clinical nurses who are actively participating in that meeting. They've helped design the protocol. They are collecting the data. They are being mentored by you in data analysis. They have the opportunity to present and to publish this work as well. So we're really looking for that. Our goal is to grow the expertise of our clinical nurses.
Yeah, definitely. Thank you so much.
And just quickly, for those who may need to leave the call early, I encourage you to scan the QR code or take down the link here so you can complete the survey to provide feedback as we continue to take questions.
I just as Christina Baker again asked real quickly. My research project involves kids with type 1 diabetes, but also kids kids with other chronic medical conditions. So is that something that would qualify?
Liz, do you want to speak to that?
So again, the study populations are only the study populations who have oncology or autoimmune disorders. So, you know, sometimes we'll see and we'll say we're going to try an evidence-based practice initiative on our unit, and there happen to be children with cancer on our unit. We do not fund those studies. We want 100% of your population to fall within our target population.
But I think type 1 diabetes would likely qualify, correct?
That is correct. Yes, that is correct as an autoimmune disorder.
And part of my study, though, with the school nurses does look at kids with like asthma and other conditions too, but definitely type 1 diabetes was the main focus.
Right. So if you were to write a proposal, the proposal would only be the recruitment or the inclusion of children with type 1 diabetes. You may be working with other populations concurrently, but what our funding would be for would be only for those unique populations.
Okay, thank you.
This is Amy Marabella, and I'm a clinical research nurse at Honor Health, work on oncology clinical trials. So my title is a research nurse, but I am a clinical nurse because I provide care in the clinic to these patients. So would our team of clinical research nurses qualify?
Yes, they would qualify. The only thing that we can't do is essentially our budget wouldn't allow to pay for a research nurse specifically for the purpose of conduct of the study. But it could purchase out clinical nurse time to participate. So I don't know if that is clear enough a distinction. If you have follow-up, we certainly can answer that as well.
Okay, no, that's helpful. Thank you.
Are there any other questions before we end for today? I'd like to also go back and just acknowledge Bonnie and Erin at the Daisy Foundation for their work in coordinating this first webinar, and Liz, obviously, for your extraordinary leadership on the grant review panel. To all of you participating, I hope that you feel encouraged to apply. If you have other questions that come up beyond the context of this call, please don't hesitate to contact us. We really seek your applications as part of really expanding the care and the service that nurses can provide to patients in many different settings. And we thank all of you for your time in participating today. I don't know if Liz or Bonnie want to have any closing remarks.
Kelly, this is Bonnie. I want to say a profound thank you for all of the thought and attention you've brought to the process and your very thorough explanation of the program. I learn every time I talk to you and to Liz, and I'm so grateful for your time and involvement with what we do every day here at the Daisy Foundation.
Well, thank you.